Welcome to Calm Mind and Healthy Body, our channel. Vitamins and minerals are crucial in maintaining our overall health and well-being. Vitamin B12, D, and iron are essential nutrients for various bodily functions. In this video, we will delve into the topic of 6 devastating vitamin deficiencies, focusing on the impact of deficiencies in vitamin B12, vitamin D, and iron. Vitamins and iron are vital for the proper functioning of our bodies. Vitamin B12 is essential for nerve function, DNA synthesis, and red blood cell production. Vitamin D is crucial for bone health, immune function, and mood regulation. Iron is necessary for oxygen transport in the blood and energy production. Without an adequate intake of these nutrients, our bodies can experience various health issues. Identifying and addressing vitamin B12, D, and iron deficiencies is crucial to preventing serious health complications. Deficiencies in these nutrients can lead to fatigue, weakness, impaired cognitive function, and increased susceptibility to infections. Long-term deficiencies can result in more severe conditions, such as anemia, osteoporosis, and neurological disorders. The impact of vitamin and iron deficiencies on daily life and well-being cannot be understated. Imagine feeling constantly tired and weak, struggling to concentrate, and experiencing frequent mood swings. These are just some of how vitamin B12, vitamin D, and iron deficiencies can affect our quality of life. We can improve our health and well-being by addressing these deficiencies through proper nutrition and supplementation. If you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell so you never miss an update on health tips, recipes, and wellness inspiration. I appreciate your support. In the upcoming segments, we will explore these deficiencies in more detail, discussing their symptoms, causes, and treatment options. Stay tuned to learn how to optimize your nutrient intake and safeguard your health. Vitamin B12, also known as cobalamin, is a crucial nutrient vital to various bodily functions. In this segment, we will explore the causes, symptoms, and consequences of vitamin B12 deficiency, shedding light on the importance of this essential vitamin. Vitamin B12 is essential for producing red blood cells, which carry oxygen throughout the body. It also plays a crucial role in maintaining nerve health and supporting the proper functioning of the brain. Without an adequate supply of vitamin B12, these vital processes can be disrupted, leading to various health issues. Several common risk factors can contribute to vitamin B12 deficiency. One of the primary factors is diet, as vitamin B12 is predominantly found in animal-based foods such as meat, fish, and dairy products. Vegetarians and vegans are at a higher risk of developing a deficiency if they do not supplement their diet with vitamin B12. Additionally, as we age, our bodies may have difficulty absorbing vitamin B12 from food, increasing the likelihood of deficiency. Untreated vitamin B12 deficiency can have severe consequences for our health. One of the most common outcomes is anemia, a condition characterized by a lack of healthy red blood cells. Symptoms of anemia include fatigue, weakness, and shortness of breath. Long-term vitamin B12 deficiency can also lead to neurological problems, such as numbness and tingling in the hands and feet, difficulty walking, and memory loss. By understanding the causes, symptoms, and consequences of vitamin B12 deficiency, we can take proactive steps to ensure optimal levels of this essential nutrient for our overall health and well-being. Stay tuned for more insights on how to address and prevent vitamin B12 deficiency. Vitamin D, often called the sunshine vitamin, is a crucial nutrient that significantly maintains our overall health. In this segment, we will provide insights on recognizing, treating, and preventing vitamin D deficiency, ensuring optimal levels of this essential vitamin for our well-being. Vitamin D can be obtained from various sources, including fatty fish, fortified dairy products, and egg yolks. However, one of the primary sources of vitamin D is sunlight exposure. When our skin is exposed to sunlight, it produces vitamin D naturally. Spending time outdoors, especially during peak sunlight hours, can help boost our vitamin D levels and support overall health. Vitamin D deficiency can manifest in various ways, including fatigue, muscle weakness, bone pain, and frequent infections. Inadequate levels of vitamin D can also significantly impact bone health, leading to conditions such as osteoporosis and increased risk of fractures. Furthermore, vitamin D plays a crucial role in supporting our immune system, and deficiency can compromise our body's ability to fight off infections. If you suspect you may have a vitamin D deficiency, there are practical steps you can take to address it. Increasing vitamin D-rich foods such as salmon, tuna, and fortified cereals can help boost your levels. Vitamin D supplements are also available for those who may have difficulty obtaining enough vitamin D through diet and sunlight exposure. Consulting with a healthcare provider to determine the appropriate dosage is recommended. By recognizing the signs of vitamin D deficiency, making dietary adjustments, and considering supplementation when necessary, you can effectively manage and prevent vitamin D deficiency, promoting optimal health and well-being. Stay tuned for more tips on optimizing vitamin D levels for a healthier lifestyle. Iron is crucial in bodily functions, including oxygen transport, energy production, and overall health. In this segment, we will examine the causes of iron deficiency and explore practical strategies for managing and preventing it to support optimal health. Iron is essential for producing hemoglobin, a protein in red blood cells that carries oxygen from the lungs to tissues throughout the body. Iron also plays a crucial role in energy production, DNA synthesis, and immune function. Without an adequate supply of iron, our bodies may struggle to perform these essential functions, leading to various health issues. Iron deficiency can occur due to various factors, with poor diet being a primary cause. A diet lacking in iron-rich foods such as red meat, poultry, beans, and leafy greens can contribute to low iron levels. Blood loss from menstruation, gastrointestinal bleeding, or other medical conditions can deplete iron stores. Specific absorption issues, such as celiac disease or gastric bypass surgery, can also hinder the body's ability to absorb iron effectively. To address iron deficiency, incorporating iron-rich foods into your diet is essential. Foods such as lean meats, seafood, beans, nuts, and fortified cereals are excellent sources of iron. Iron supplements may be recommended for individuals with severe deficiencies or those who have difficulty meeting their iron needs through diet alone. Making lifestyle changes such as avoiding excessive caffeine consumption, inhibiting iron absorption, and pairing iron-rich foods with vitamin C-rich foods to enhance absorption can also help combat iron deficiency. By understanding the causes of iron deficiency and implementing strategies to increase iron intake, you can effectively manage and prevent iron deficiency, supporting optimal health and well-being. Stay tuned for more insights on maintaining healthy iron levels for overall wellness. In this segment, we will highlight the potential risks of long-term vitamin deficiencies and explore how they can impact organ function, disease development, energy levels, cognitive function, and immune response. Long-term vitamin deficiencies can significantly impact organ function and increase the risk of developing various diseases. For example, vitamin D deficiency has been linked to bone disorders such as osteoporosis and increased susceptibility to infections. Vitamin B12 deficiency can lead to neurological problems, anemia, and cardiovascular issues. Iron deficiency can result in anemia, impaired cognitive function, and weakened immune response. These deficiencies can have far-reaching consequences on our health if left untreated. Vitamin deficiencies can also profoundly affect our daily functioning. Inadequate levels of essential vitamins can lead to fatigue, weakness, and decreased energy levels, making it challenging to perform daily tasks. Cognitive function may also be impaired, resulting in difficulties in memory, concentration, and mental clarity. Furthermore, vitamin deficiencies can weaken our immune response, leaving us more vulnerable to infections and illnesses. Early detection and intervention are crucial in preventing severe health complications associated with vitamin deficiencies. Regular health screenings, blood tests, and consultation with healthcare providers can help identify weaknesses early on. Stay informed, stay proactive, and prioritize your nutrient intake for optimal well-being. Vitamin deficiencies, particularly in vitamin B12, D, and iron, can significantly impact our health and well-being. Addressing these deficiencies promptly is crucial to preventing serious health complications and optimizing our quality of life. Vitamin D deficiency may result in bone disorders, weakened immune response, and fatigue due to its role in bone health and immune function. Iron deficiency can cause anemia, cognitive impairment, and weakened immune response, affecting oxygen transport and energy production in the body. We must prioritize regular health checkups and blood tests to monitor our vitamin levels. Monitoring our vitamin status can help detect deficiencies early on and guide appropriate interventions to prevent health complications. Consulting with healthcare providers for personalized recommendations is critical to maintaining optimal nutrient levels. Promoting balanced diet, sunlight exposure, and supplementation. A balanced diet rich in vitamin and iron sources is fundamental for meeting our nutrient needs. Incorporating lean meats, fish, dairy products, fruits, and vegetables can help ensure adequate intake of essential vitamins and minerals. In cases where dietary intake may be insufficient, supplementation under healthcare provider guidance can be beneficial for maintaining optimal nutrient levels. By prioritizing regular health checkups, maintaining a balanced diet, getting adequate sunlight exposure, and considering appropriate supplementation, we can proactively address and prevent vitamin deficiencies, promoting overall health and well-being. Remember, your health is your greatest asset. Invest in it wisely.